I'm Jamie Lazinski, the Senior Director of Communications for Oswego Health. Today we are at the Center for Wound Healing at Oswego Health. It's right off the third floor of Oswego Hospital, and with me today I have Dr. Dator, our Medical Director, and Kristen Naylor. So guys, tell me a little bit about where we are. What is the Center for Wound Healing?
Yeah, so we've been here for about maybe 4 years, 5 years. Typically we've kind of found this niche where a lot of people in the community have gotten these wounds, whether they be acute, a burn, something on their leg, something on their foot, that, sometimes a regular Band-Aid and Neosporin really doesn't work. So, our job here is to kind of help move that along in the process with seeing, our provider here, the nurses here, and then also sometimes home care, helping you at home to kind of make sure that everything gets tidied up in a faster fashion than it would be by yourself at home.
Oh, wow. Okay. So, Kristen, what kind of patients do we see here? Are they typically senior citizens? Are they younger? Do they have diabetes? Like, what kind of patients do you see?
That's the beauty of wound care. There's really no typical patient here. We see 18-year-olds up to 100-year-olds. We get a lot of diabetic patients. It's kind of the nature of the beast here, but as Dr. Dator said, we see burns, we see leg wounds for patients that have swelling, we see a lot of car door injuries and dishwasher injuries. I mean, you name it, we see it here and we treat it here.
Oh, wow. So, like, typically, are they in it for the long haul? I mean, if they have a severe wound, are they coming, 10, 12 times? Or typically, what can someone expect?
Yeah, I think we've done a pretty good job here in trying to hammer it down to where our goal is, we say around 30 to 35 to 40 days, we're going to turn you around on average, whether it be a chronic wound or something really small or an accident, like Kristen was saying, in a dishwasher accident. So, our goal is right around that 30-day mark, whether it be sooner, a little bit longer, kind of based on the complexity. That's kind of what our goal as as our center is in terms of meeting their goal in terms of getting tissues and wounds all healed. Sometimes I think we've seen patients just for one day, giving them a special bandage that we have in our closet that no one else has. And then some people might end up staying for, a couple, 2 or 3 months, because for that reason, it might be a bigger wound that we might need a couple different things. And then obviously we have the hyperbarics, which I think we'll get to later.
Yeah, absolutely.
And that usually takes about 40 treatments or kind of 4 to 6 weeks.
Yeah.
So it's a big, kind of like just like she said, very, very variable.
Perfect. Well, maybe if you guys wouldn't mind, maybe give us a little bit of a tour.
Sure.
All right, so let's kind of walk down the hallway. So how many treatment rooms do you guys have here in the Center for Wound Healing?
So there's 4 treatment rooms here and we have 2 hyperbaric chambers on campus.
And what's the staff size? I mean, we've got Dr. Dator here, you, Kristen. Who else is a part of your team?
We also have our full-time provider, Tiana Bergeron. She's a nurse practitioner here that sees a majority of the patients. There's myself, the nurse manager, the safety director for hyperbarics, Katie, and I have 2 other full-time RN staff. We also have some other per diem staff here too for when the season starts to pick up and flip-flop season comes out and all of those new leg wounds start to crop up. So yes, we are pretty well staffed here.
All right, so let's kind of keep walking down here.
I'd probably say that, just based on all the patient kind of comments, it's a really nice center in terms of it's pretty new. The chambers are new, one of the newer things here in the hospital. But more or less, the bottom line, you'll hear from patients and anyone around the community, they just love the staff. That's what keeps them coming back.
I know, they're like one of my favorite departments too, because we constantly are getting great patient reviews about you guys. You're so friendly, and I think you have to be in the nature of wound healing, right? I mean, it's got to be a very frustrating process and delicate process. So
there's a very good relationship that they kind of make with the patients, because they have to see them on a weekly basis. So there's like a rapport that happens coming in for that week, every 4 weeks, or even sometimes a couple times more during the week. I think the staff, it just makes it a testament to the staff and how well they kind of are in the community and kind of like have dived in the community to make themselves a part of it.
Yeah. So let's maybe look at treatment room 3.
Come on in. So in here, you'll see our standard chair, Nothing scary. They're not tiny, cramped little rooms. We try to keep it really warm and inviting and large. That's one thing that everybody notices here is there's room for your wheelchair. There's room to bring a family member with you because it's scary. It's natural for people to be hesitant. So we try to take that out of everything. And we have Tiana, the nurse practitioner here that sees the majority of the patients. She is getting ready to do a telehealth phone call. It's one of our newest and biggest things that we've been doing here. It's really helped us combat COVID and getting the care that the patients need through the help of home care and things like that. Ty, what's some of the stuff that we do here for the patients?
Yeah, so chances are if you come to the wound care center, you're going to see me and the other people of the staff. And we see you on a weekly basis. You come in, you're greeted, big smiles. We love getting to know our patients. And from there, we just kind of treat your wounds. We look at you as a whole person. What's going on? Do you have diabetes? Do you have any heart problems? Do you have swelling down in your legs? Maybe you or a family member are in a wheelchair the majority of the time and you have some wounds going on your backside. Maybe you recently had a surgery and you're not healing like you should be. And the surgeon's kind of saying, oh, well, you know, we're just going to wait till you heal, but maybe you just want a little extra boost. So you come to the wound care center. What's been great about COVID-19 is that we've actually learned how to do a lot of our visits over the phone. So sometimes our patients have home health care. They give us a call, send us pictures or FaceTime, and we're able to actually visualize the wounds and decide what are the best dressings that would work for you. Maybe you need a culture of the wound to see if there's any infection going on there. Maybe you need some blood work or an x-ray, and those are all things that we can order to be done at home sometimes.
Awesome. Well, thanks, Tiana. All right, so maybe the one thing I'm really excited to see and to show the community is the hyperbaric chambers. Right?
Yeah.
So why don't we walk over there? You can give us a little bit more details about the hyperbaric chambers, but I think the one thing that's important to note, does every hospital have a center for wound healing? I mean, is this unique to Oswego County? Is this unique to our hospital? I've not seen a lot of centers around the country.
Hillogix itself has over 700 centers. In Oswego County, to my knowledge, we are the only wound care center. Of course, primary care practices will treat, minor things. Urgent care is great at triaging those wounds, and they're typically sending them to us. The next closest ones, unfortunately, are in Syracuse or in Watertown. So we really found a nice little niche here in Oswego County to be somebody nice and local, especially with transportation being an issue, snow, weather, it's
Plus,
really
we
close.
also offer valet here too, so your patients take advantage of that a lot,
Yes.
right?
Yeah.
And that's free.
Very, very helpful, especially the people that are kind of wheelchair bound or need assistance with walking and ambulation. That's helped them tremendously in kind of being able to get to their visits and being able to be seen by the provider on a regular basis.
Oh, absolutely. Well, let's head on down
Sure.
to the chamber. All right, so right now, explain to me a little bit about where we are, because this is a little overwhelming, I gotta be honest with you.
Sure.
So tell me, at what point does a patient come into our hyperbaric chambers, and what is the treatment process like?
Sure. So once the providers have found a patient that they think is appropriate for hyperbaric, so a patient with a bone infection such as osteomyelitis, tissue damage from having radiation, things like that. Katie is the guru back here. She is the safety director here. This is her show. She starts the process of working them up, does insurance verifications, does the whole process on getting them prepped and ready to come into the chambers. So Katie, do you know what that process is like a little bit more for them?
Yeah, so when a patient comes in here for their first treatment, we'll go over an orientation. What they'll do is they'll come in here, get undressed. The chamber will do your basic vital signs. A provider will look at their ears, listen to their lungs, their heart, and then we'll kind of slide them into the chamber, and they're breathing in 100% oxygen at a deeper depth. and that's how they can kind of, help heal wounds that are difficult to heal.
Yeah, we pretty much just saturate whatever injury or whatever infection that they have with a lot of this oxygen to make sure that like the tissue has enough of these like building products to build the tissue, or enough of the oxygen to kind of get into the infection and kind of help heal that out. Really, the biggest thing is just making sure that they're comfortable in that chamber, right? Because it is intimidating, like you said, but we do our best. Katie's always here at the bedside. There's always communication between the patient and her. There's a TV, as you can see, on top of the chamber for them to kind of watch TV, watch movies, listen to the radio, and then you're looking for the patient to be there typically between 2 to 6 hours, maybe 2 to 4 hours sometimes, just depending on how the treatment goes. And really, I'd probably say the majority of them end up falling asleep.
Yep.
Because
That
they're
sounds
so
real
relaxed.
relaxing.
Yeah.
Yeah, absolutely, absolutely. So what is like the success rate? I mean, you guys have won a lot of awards for this center, right? So what is the success rate that you've had with the chamber here as well as with just treatment in general?
It's hard to really put a number on success rate because success for one person may be
True.
completely healing out a wound. We get a lot of toe wounds from our diabetic patients. So to heal out a wound completely that they don't have to worry about doing dressing changes or doing IV antibiotics anymore, that's a win for them. But we also have patients that have had cancer treatments that have the destruction of their tissues. And so for them just to be able to go out and go to their grandchild's birthday party or to go on a road trip or something like that, that's been a win for them. So there's not a real number because it hasn't worked for everybody. We've had patients that just don't have the vascular status to heal. So unfortunately, they do end up with an amputation, but the win for them is they're ready for that surgery and they're ready to heal after that amputation. So there's so many uses for it. And it's really been a testament to the center.
I will have to say though, with the chambers here and then everything that, the staff does on the other side of those examining rooms, as Kristen mentioned, there's about 700 of these centers throughout the nation and throughout the country. And we've got that distinction of being like the top 10% of those 700. So, again, I think that's just a combination of everything between home care, getting coordinated with the bandages, hyperbarics, and then the staff. So it's a really proud moment to kind of carry that distinction and get those awards on the wall. But I think for us, it's really making sure that that patient, just like Kristen said, has that quality of life. If they're walking on the foot, they're ready to kind of get back in the community. And they're not dealing with something that is kind of seeping through their clothes, right?
Absolutely. So, I mean, the staff's amazing, award-winning facility, amazing treatment. How does a patient get started? Like, what do they need to do? They need a doctor's referral? Like,
No referral. They can
No
just call.
referral. They can just call you.
We'll get them in.
They'll call you, get them in, and you can either do it telehealth or come on into the center, right?
Yeah.
Awesome.
Yeah, I think the majority of the patients that we see, I'd probably say at least half call. They say, hey, I heard about you. I have this wound. We fit you in there within the week or two. We get a lot of referrals from urgent care, from the emergency department, saying, hey, this looks a little bit more than you might be able to handle. Why don't you go see them next week or this week? So, it's a very easy process for anyone to start seeing these guys.
Awesome. Well, Katie, Kristen, Dr. Dator, thank you so much. We hope you'll consider taking a look at our website for more information about a Center for Wound Healing. Give us a call. I hope to see you soon.
Okay.
Thanks so
Thank
much.
you.
Thank you.